Chris just have a seat there for me, thank you.
The eyeConnect device has been developed to help patients who live in outer metropolitan, rural or regional areas access the expertise of a specialist without having to travel long distances. The device collects patient data, visual acuity and images of the eye and sends them to the emergency department at the Royal Victorian Eye and Ear Hospital. After reviewing the information and the images, a doctor at the eye and ear will advise if the patient needs to present to the eye and ear emergency department for treatment or can remain at their location. Before starting the session, assess if your patient fits the criteria for eyeConnect. Is there sufficient concern to consider specialist advice? Is the condition acute or subacute? Does the patient consent to having their medical information transmitted to another hospital and to having a medical record created for them at that hospital? You should not use the eyeConnect device when the patient can be managed without eyeConnect support. It is apparent that specialist review is required immediately, where capturing information delays appropriate care, for example, chemical burns, if the patient has open facial wounds, if the patient refuses. To conduct the session, ensure the monitor is switched on. Click the eyeConnect icon to start the program if it is not already running. Enter your details into the first screen. You will be asked to enter your phone number every time you commence a new consultation. This is very important as this is the number the eye and ear will use to contact you to discuss the patient. Select the eye you will be examining and make an approximation of the eye colour and skin pigmentation of the patient. Selecting fair, medium or dark will change the illumination settings in the device camera and improve the quality of the images. After you have entered the patient's details, you will be taken to the patient history screen. Before commencing the history, you must gain the patient's consent to proceed. After answering the patient information questions, you will be prompted to align the patient's eye on the eyeConnect device. Use the knob to adjust the chin rest height so that the lateral canthus of the patient's eye aligns with the groove on the chin rest upright. Use the Google arrows to centre the patient's pupil within the red crosshairs. Use the positive and negative keys to move the white slits. They should bracket the pupil and align the red crosshairs. Take your time to ensure the white slits are curved like this and not like this. If the slits are not curved correctly, the images will be out of focus. The device will then take the patient through some visual acuity tests using the Snellen chart and the Amsler grid.
O and Z, top right hand side.
The patient can wear their visual aids during these tests. Follow the instructions that appear in the screen to conduct these tests. On the screens where an image will be captured, 2 to 4 icons will appear and indicate which illumination lights will be used. Ask the patient to remove their glasses if they are wearing them. It is important to warn the patient you are about to take a photo. Ask them to keep their eye open and still and to be prepared for a bright light. Right-click the figure to capture an image. You will have the option of taking fluorescein images and checking the patient's intraocular pressure using the disposable tonometer. If the patient is wearing contact lenses, ensure they remove them prior to instilling fluorescein or taking IOP. If you choose not to conduct a fluorescein test or take the patient's IOP, select the red Skip button. Enter your reason for skipping these tests in the pop-up box. Once all the information and images have been captured, you will need to review the package to confirm the details and confirm that the images are acceptable. At this point, if you want to retake any of the images or redo any of the visual acuity tests, click on the screen icon of the page you want to review. When you are ready to transmit the information to the eye and ear, click Send Package. A confirmation that the information has been sent successfully will appear. If for any reason the package does not send, The device will store the information and send it as soon as it is able. Wipe the chin rest and forehead strap over with alcohol wipes between each patient. Never use alcohol wipes on the camera lenses. At the Eye and Ear Emergency Department, an alert will notify them about the incoming telehealth package. You will receive a phone call from the clerical staff telling you approximately how long it will be before a doctor can review the package. Once the package has been reviewed, a doctor will ring you on the number you provided and give advice on whether the patient needs to be transferred to the emergency department at the Eye and Ear. They will also document the outcome of your conversation and the advice provided. Make sure you both pause to take time out to ensure you are both reviewing the right images for the right patient.